Community health centers fulfill an essential role in our nation's healthcare system and are leading the discussion about healthcare in the South Dallas Fair Park community. National Health Center Week is designed to raise awareness about the mission and accomplishments of these all-important healthcare facilities. Foremost Family Health Centers is one of North Texas' largest community health centers and one of the state's more effective at community outreach. Foremost recently hosted a community conversation panel during National Health Center Week 2022. The event, Creating a Culture of Health in South Dallas Fair Park, was an informative and enthusiastically embraced gathering. The evening brought together a collection of Dallas's more prominent community organizers and thought leaders. In attendance were Diane Ragsdale, former Dallas City Council member and the Executive Director of Inner City Development Corporation; Brian Llewellyn, CEO, Fair Park First; Joy Woods Bennett, Health Policy Researcher at Dallas Black Chamber of Commerce; LaRonda Bacon, Supervisor, Office of Community Care, the MLK Junior Community Center; and Joyce Tapley, CEO, Martin Luther King Jr. Clinic and CEO, Foremost Family Health Centers. Coming up next are highlights from this important community event.
The first question, what is currently the greatest challenge to healthcare and creating a culture of health in South Dallas Fair Park?
I think the reality is that what we continue to find is that there's a direct relationship between one's living conditions and one's health. And so what you have here really is really poor, disenfranchised neighborhoods, most of whom are people are working, poor people. And so the data, and I'm trying to take from the doctor here, but the research has shown that only 20% of one's health outcomes is determined by quality healthcare services. Mm-hmm. So what happens with the other 80%? Remember that only 20% of one's overall health outcomes or health status is determined by quality healthcare services. So while this center is extremely important, the social determinants of health happen to be more important, meaning those other things that are non-medical, if you will. And so that is really, as a registered nurse, I came out of Dallas Baptist when it was DBC, Dallas Baptist College, and it's now DBU. But the key to, as an RN, I left the typical nursing career, if you will, and I wanted to move toward attempting to address the underlying causes. What can I do to prevent illnesses? And really, I worked in CCU, I worked in ICU, I worked in step down. I never got so tired of reacting to people's illnesses. And so to that end, I decided to move into an area and become one of the founders of a community-based group that could very well address those underlying causes, such as, and we'll get to those, affordable housing or the lack thereof, but overall the answer is trying to confront those underlying causes. That is what we have not done. We have to go beyond the centers and go to the field and address those underlying causes of illnesses. That's what is preventing the culture of health.
So you mentioned education. So we don't have, even the schools, they don't have all of the tools and resources that they need like they do on the other side of the tracks. Mm-hmm. That we have, we know that folks don't have good food.
Mm-hmm. That's correct.
So then we are lacking the proper types of grocery stores and other green space that will allow people, and people should not have to grow their own foods to be able to eat good foods. There should be companies that come in and provide that high level of meats and vegetables and everything else that people need. The education part, we talked about the resources. Transportation is still a big issue. People can't get down here. DART is doing a great job trying to get people, but that's coming from the north, coming from the east and west. The people that are right here should not have to take 3, 4, or 5 buses to get someplace. The actual places where folks live, in the policies that are needed to make sure that homes and multi-level houses and multi-family homes need to have the right type of no lead, still no lead in the paint, and no asbestos in the walls. All those things, those types of materials should not be in this area. And so unless we demand and figure out the best way to have the right types of contractors come in and do the right thing by us, we're still going to be in that same situation. So it seems to me that the challenge is everyone coming together to demand and expect the highest quality of service for all the areas that we need, so that 80% of the way the system is set up, we can change that 80%. That's what I see in a little bit of time that I've been here.
Okay, I see you ready to jump in. Go on.
Well, I think about it's really hard to follow Ms. Ragsdale. So, but I think about it is all intertwined. And one thing that I don't think people realize around South Dallas is that we're actually also a book desert, which means that each home has less than one book, max, they might have one book in the home. And so I think that it's important to even think around that, because there is a direct tie to mental health. The more you read, the younger you start reading, but also to the resources and the lack of resources that are here. One thing that I see as a challenge, and I'll admit, I'm a new resident to South Dallas. I literally can walk here, right? I've been here a year. We chose to live here. And I think that I think that a challenge is that people come in and see and when I say people, I mean organizations and other people that don't look like us, come into this neighborhood and see the problem, and instead of looking out to the resources that are already here and funding the resources that are here and connecting the resources that are here, they come in and they want to be they want to solve the problem, which therefore puts out resources like this, puts us out of business, because they're taking, they're nonprofits, so they're not coming in and they're not paying taxes. And so here we have these centers, and they're getting basically defunded because people want to come in and be saviors instead of actually just assisting what's already here. And I think that's one of the biggest challenges that is facing South Dallas right now with culture of health.
So the first question is actually the second question rather is to Ms. Tapley. Can you just speak to how are we positioned, how is Foremost positioned to create a culture of health in South Dallas over the next decade?
First of all, it takes the right type of people to want to work here. And a lot of staff members that we have are from this community or have grown up in a community very, very similar. I'm not from here, but I grew up in communities just like this and believe, just through experience, that if you care about where you are, then you're going to do all that you can to improve. So one of the things that we've done is we've received some startup funds from the federal government. So when we say that we've got federal funding, we're a $12, $13 million operation. We get about $4 million. So the rest of this money that we get in order to pay all of our bills, pay the salaries, pay our vendors, we have to generate business, which of course is seeing patients. Well, most of our patients don't have the funds to see us, but we still see them. So how do we get the money? Medicaid, Medicare, and any private insurance. And in doing so, we have to be attractive to the folks who we're trying to bring here to take care of them. And we've been able to do that because we partner with the city of Dallas. It's been a long-term partnership, and they've allowed us, and I know that Ms. Ragsdale can tell you, from the time that we started to now, we've been able to secure additional funding to expand the services within here, open up new sites, and really see a lot more people. So for one, we are able to impact and position ourselves because we've been creative on securing funding to expand internally and expand externally. Health initiatives. We are here to improve the overall health of the community. We are one of the worst health outcomes in the entire state. We need to be the best. Why? Because we have great people working here that are talented and know what they're doing, and they care about our patients. When our patients walk through the door, they may see all kinds of stuff that may deter them from coming in, but when they walk through the doors, they get professional care, timely care, comprehensive care. We educate them. They feel comfortable. They'll come back. They'll tell their friends. And if they're not satisfied, I guarantee you we're going to figure out how to make it right so that they will want to come back. So we have the drive and the determination to ensure that people come in. If they have chronic diseases, we're going to help them manage those diseases. And if they don't have any diseases, then we're going to help them prevent that. So those are ways that we can position ourselves. We are showing that we know what we're doing, and we're helping improve the overall care for people. And that's going to help us in the next decade because we are doing it and setting up a model to be replicated. The third thing is we are a key organization and a key partner in the entire Dallas-Fort Worth Metroplex. So the hospitals, when they have different funding opportunities or they have different ways to try to improve health, they invite us. Various different organizations invite us. So we're one of the key players. But it's not just about us. It's about the entire community, the South Dallas Fair Park community. And there are other organizations and practices who are trying to come in to do whatever it is they do. But we need to make sure they're going to take care of our folks. So if we can position ourselves to form a coalition, an alliance of all the different healthcare providers, plus the other non-healthcare providers, then we can start establishing what is our goal and our mission to create this culture of health. Because we can't come up with everything. Right. And we've got to bring the people who are impacted into the table, so that they can help us tell us what they really need. We can't just keep coming in and saying this is what you need. We got to find out from the people we take care of, what do they need? And that's how we position ourselves, and that's how we're going to position ourselves, I think.
Good.
Absolutely.
Thank you.
So just to follow up on that, you talked earlier about education, housing, social determinants of health. I would like Ms. Ragsdale, if you could talk a little bit about the role that housing and economic development, how that plays into creating the culture of health, and then also what resources currently exist and what's needed. Because I think sometimes people truly don't realize there's actually a lot that exists, but are they taking advantage of it, or do they even know about it?
Right, right. Well, first of all, I want to kind of reemphasize the reality that one's health and one's living conditions are so very much so connected. So we got to be concerned about people's living conditions. So when we look at housing, that's very fundamental. But that's very fundamental, and so housing certainly can have multiple health hazards that can lead to asthma, for example, or that can lead to lead poisoning, for example, or to be quite frank with you, or that can lead to emotional stress, because when people need to feel good about where they live. Okay, and the failure to feel good about that can affect one's mental health. And so who wants to go home and who wants to leave and go home to a substandard place? You know, and so with a leaking roof or a plumbing that's out of order. Those type of things affect people's mental status. And so we have to move forward through institutions like ICDC to build good homes for low to moderate income people, but also policy is important. Yes, we can't do it all by ourselves, but we got to have the type of policy, because policy affects many people. You can create a program or institutions. ICDC might affect 500 people, okay? But policy will affect thousands of people. Yeah. And so therefore we got to move forward also with the understanding that systemic policy is important. Creating good policy that can impact the lives of many. And so this is why oftentimes we look, because I'm a native Dallasite and a native South Dallasite and still living here. And I live in a home that's over 100 years old. But the key, well, of course I'm not quite that age yet. But the key though is that when we reflect back upon the neighborhoods, and we say, and even the data continues to prove this out, that we continue to have the same issues over and over again. And one of the reasons that we have the same issues is because we're not putting into place that necessary systemic policy that can impact people's lives. Transformational policy, transformative policy, and foundational policy.
Talk to us about the role that policy and advocacy, not only policy, but advocacy. Those things play into creating a culture of health. That would be very helpful. And then can you illustrate for us, what does policy look like at the individual level and then also at the community level? Because, for a lot of folks, policy is very abstract for us.
Yeah, absolutely. And I think it's one thing that has been said that I think, again, to reiterate, is that when it comes to South Dallas but comparatively to North Dallas, our zip codes live 23 years less than we can go plug in your zip code and figure out how long our life expectancy is. And so where policy comes in place, I was just talking to my coworker and some of my friends recently, policy comes in place around, well, what is a policy when public transportation builds a bus stop? Is it covered? Because it's going to be safer and more, healthy to cover a bus stop because it rains. Apparently now it snows in Texas, we're still getting used to that. But thinking around that, what is a policy on how long does it take to go fill a pothole, right? Because if I'm gonna go drive somewhere and then I'm gonna get a flat and I'm just trying to get to work and then I'm an hourly worker, and then I have to take off work and then I'm missing time, but then I get sick. It's this whole long process that when we think of policy is abstract, right? Because we see the news and it's there's this policy passed. But, and it does take a lot. You do have to have a privilege to sit down and read through these documents. But at the local level, it's what your city council is passing. It's what your public transportation is doing, what resources your public library offers, what resources your centers offer. How much does it cost to go to a swim class? How much does it cost to go to a Zumba class that the city will put on? What are the policies at your local level, even in your jobs? And so, again, as a political science person, I'm always going to say get out and vote. And I know it's not a presidential year, but I think one thing that we really do underestimate is the power of local policy. Because the school board from your city council to, even what referendums are on the ballot to see what your taxes are gonna raise. And, the news just came out with what is gonna happen with our cellular phone bills gonna go up, as well as our energy bills are gonna go up, as well as the inflation reduction. So everything that people say, it's really hard to focus on, but finding those people who can explain to you, how does this affect me on the day-to-day and how will it affect my health?
Mm-hmm. Absolutely. Did anybody else want to jump in or piggyback on that?
I just wanted to add vote. Because that is a key. We just have to, it would be nice if some media group would constantly feed the information to those who watch TV or those on social media. And because everybody doesn't always go through the newspaper and try to read all of that. But the more we can pass that information out to the community, then they'll understand why it's important when it's time to vote for even these local elections, as often as they may be, that people need to do that in order to really make a change.
Well, I want to emphasize and reemphasize as well we want people to vote, but we gotta make voting relevant to our lives, okay? And oftentimes, it's kind of like my pastor when he gives his tremendous sermons. He always says, "Let me make the word live for you." And so the question is, let me make the word of God live for you. So the question is, how do we make voting live for people? And so that's what's missing. We say vote, but we don't tie voting to people's day-to-day lives. Okay, and that's what's so very critical, and we fail to do that. And also, we can't wait till voting time. We have to do ongoing organizing, getting people properly educated and prepared to vote and to change policy, et cetera. So yes, voting is important, but we got to start early and we got to make it live for people.
But also,
Go ahead.
Yeah, right.
but also, but also in the voting, again, we keep talking about what needs to happen for the whole. I'm always about starting at home first. And when you're starting at home, and we have so many of our younger people who were not taught by parents or didn't have that grandmother or that auntie or someone that could teach them about voting, that voting needs to happen every time there's a vote out there. Or as I believe Ms. Ragsdale said, explaining it to the smallest level of this policy or proposition is going to help you in your daily life with your new cell phone bill, with your this. It's making it livable, as you said. So I totally agree when it comes down to every health culture. I was messing with her earlier about that word culture, because it's something that I hear all the younger people, I never thought I would say younger people, but I hear the younger people using a lot. You know, it's to me, it always starts at home, and the grassroots start at home. This community center, I just finished writing history and pulling history about just the Martin Luther King Jr. Community Center admin. It's a lot going on this 11.5 acres campus. And the same thing that they set, and Ms. Ragsdale was a part of that, the same measurements that they set back then are still relevant right now. That's all.
You wanted to add one more thing?
Yeah, I was gonna say, as the youngest person at the table, apparently.
No, I'm younger than
Yeah,
you.
you younger than me.
I'm younger than you.
That's what people say.
I'm younger than you.
When it goes to teaching about voting, I've talked to my husband about this, of like, when we were in school, they would just say, go vote. And it is so important that I think that so many people don't even grasp, like, the fact that we now have a new sidewalk around the park out here. That is a livable voting policy in front of our face. Same thing, you know, fences and stuff like that. Even when we look back into what happened in when these homes were taken due to eminent domain, that was a voting situation. Granted, the city looked way different and people who were in charge looked way different, but that was something that is voted on. And it really does come down to why we should vote, what does every day look like, because it does affect our health, but also the history. I think people are really digging more into the history of South Dallas and understanding that, oh, in order for that not to happen, we need to know as much as possible.
How many of you know that we now have a culture or a district that includes Queen City, Wheatley Place? Anybody know? This was passed last year. Well, you know this. So, Mr. Llewellyn, can you talk a little bit about that change? Because to me, that is policy too.
It is
of course,
policy.
Yeah, so talk a little bit about
And
that.
it's also a matter of yet another thing that resulted this community being ignored. There is a powerful state funding mechanism for cultural districts. We've only ever had one, and it was the Arts District. Then about 2 years ago, Deep Ellum got their designation. The city had attempted for about 8 years to get such a designation for this, and for whatever reason, they weren't able to get that done. The city finally looked to our organization because we have some expertise in marketing, cultural affairs, cultural activities, things of that nature, to see if we could get that designation done. We did. And so the state of Texas now, beginning every fall, will be distributing dollars that can go into that cultural district and help promote activities at, say, Forest Theater, the African American Museum, many of the arts galleries in Expo Park, et cetera, the Juanita Craft Civil Rights House. All of those things fall into that. But very specifically, this program is about providing funding to help promote unique businesses, unique locations, and encouraging people to come visit and spend money. So really, it is an economic development tool. But it feels fun to talk about arts and culture, and sometimes people gloss over that, but that's the importance of policy that we've been talking about, because here is yet another mechanism that could be providing dollars that don't come from our property tax, right? Or rather, they do. They've already been taken. They've just been given to other cities, right? And now here's an opportunity to keep some of those here and use those to promote activities for organizations that have been around for a long time. But you have to be laser focused on getting things done. Building the political will to get a designation like that in Austin takes a tremendous amount of risk. You have to be willing to fail politically, and a lot of people don't want to do that. The city of Dallas clearly wasn't willing to invest the kind of political capital necessary to pull that off. Now, we're members of that cultural district, but really, over the course of the next year. Yes, ma'am. Fair Park as a whole, along with several of our resident cultural institutions like the African American Museum of Broadway, Dallas, But other organizations can become part of it if they're not already recognized. It's a geographical designation that really begins right where I-30 passes over Expo Park, swings across the Fair Park campus to pick up the South Dallas Cultural Center, and then swings up Martin Luther King and terminates at the Forest Theater. So everything that Elizabeth Watley's team's doing out there is going to be included in that as well.
So, excuse me, so.
Yes, ma'am.
So west of the 45, after Forest Theater is not included?
No, ma'am. So in the future, there's a possibility to get a further designation. They have to be of a certain size. And again, this is policy, right? And some people get bored with that. I get excited because it's the kind of fundraising I find most interesting, is to find these programs that have been sitting on a shelf somewhere and find a way to make those work for the community. That's very intriguing to me. And that is one way that we can focus on health. For us, we're so incidental to the important work that these powerful women are doing. We want to be able to afford a better quality of life. We want to be a better neighbor. We want you to enjoy the park as a means of affirming your own health. But one of the things we can do to help the general health of the community as a whole is act as a connector for things like that. And when we can, we're happy to do so.
Question, I'm sorry.
yeah, go right
So
ahead. Yes, ma'am.
is PID a part of this arts district?
It's one overlay. The PID is yet another mechanism. That one is here local, so that's local taxes going in, and that is city-run. This one's state-run.
Okay.
They distribute it into the cultural district, and then there's a coalition of organizations that have been meeting about getting this done for 8 years. But without the city pressing it and expending the political capital, the time and effort to build will and get people to take it seriously, it does not happen. So we're happy to spend that. We're a fairly new organization, so we can take some black eyes.
What social and community-based services do you feel we would need to create a culture of health?
I believe that at this point, it's taking what we already have and making it stronger, making it more available. A lot of times, I just working in the admin, just looking at the cultural events that we do. It's disheartening sometimes when our community that are right around the circle sometimes call us and say that they didn't know. So we're trying to utilize more website, more Facebooks, more, then our older crowd tells us we're not on those computers, we need a flyer. So it's always ever changing. So I believe that we definitely have to continue to look at South Dallas as a whole, and continue to do everything that we know worked, to continue to work it the way that it has. So with us in the admin office, and Natasha Cooper has been great as getting us on board and more electronic based for our younger crew. But for our seasoned saints that still come in the building, we make sure that we have paper ready for them. We make sure that our caseworkers are available to explain to them, because sometimes it's all about explaining it and making sure that the documents are available.
What are your thoughts about our formalizing it could be, I don't know if it's called a coalition, an alliance, but I think it's really important that with all of these different companies coming into South Dallas, and we find out about it on a newscast or something like that, and we had no conversation when they came in. What are your thoughts about formalizing something, some kind of alliance that way, where we can be the group that brings everybody together on a regular basis so we can talk about all of what we're doing and how we're impacting the community, and just make sure that we're not replicating, duplicating services or pulling services away from one another, but really working together to provide as much as we can to as many people as we can.
So to clarify, you're asking, so we can answer this, are you asking how the current people can come together and tell the new people what's going on? Or us just talking amongst ourselves?
All of us coming together
Okay.
to decide on how we shape the community in the future as a group partnership, not just the people at the table. I'm talking about
Right.
everybody that's currently in.
Right.
Because everybody is kind of doing their own thing for the most part, or there may be a couple of people, groups doing it, and there's a couple other people doing it. But we really do need to have some formalized way that we're all working together and we're all talking together. I mean, DFW has an alliance, and we've got a Best Southwest partnership, which is a lot of cities on the southwest side. So we can do the same thing for South Fair Park, South Dallas Fair Park.
And some of us have, and you're right, and for instance, ICDC is a part of a housing coalition now. But does that mean, Joyce, that is that not a community health or a health-related coalition in the South Dallas area?
No,
Okay,
ma'am,
good.
it's not. But
Well, no, I'm talking
Yeah.
about I'm just dealing with health right
Yeah,
now. From Baylor to City Square to right.
Parkland, all the,
That's
There's
right, Parkland, that's
yeah.
right. So there's not a
Not one for South Dallas Fair Park.
Well, that's what I'm asking.
There is not one. So unless one popped up, but I didn't know about it, and it's possible because there are things that happen that we don't always hear about. But I just believe that that's one of the places that we can potentially start with, trying to coordinate that vision for health for Fair Park, South Dallas Fair Park.
And I believe it's necessary, but I think we need to look at what does exist.
That happen. So I do want to just give the wonderful audience here, our guests, an opportunity to ask any questions if they have any before we move into the group discussion, or the small group discussion.
I am a community partner at the Martin Luther King Center. We're so excited, but I said all that to say I have family, born and raised, the heart of South Dallas. And I remember the pulse of a thriving community when we were growing up. It was safe for us to walk down the street and go to the candy shop and, get candy and pickles. And it was 8 o'clock at night. And, at the fair, we would be out there till midnight, and it was safe. And there was this, to me, it was a rumor mill that was designed to tear down a stable and thriving community. And we fed into it as a people. And so when we hear things like, don't go down there, and, it's not safe to go, that's just what it is. It's hearsay. If we want to spread the word, reach one, teach one, spread the word, say something. Now that you're here, now that you have heard wonderful things and we're trying to grow again and thrive, say something to your fellow men, fellow women. With that being said, all of my men, Black men, Latino men, they're like, well, Miss Sapia, why did y'all choose a Martin Luther King Center? We can't go over there at certain times. And they're like, yes, you can, you are. And they did, and they were fine. It was okay. It was okay. But then we're charging them with the test. And now that you're here and now that you see it's okay, it's safe, there's playgrounds and trees, and we actually have grass, tell somebody. Sometimes just a good old-fashioned word of mouth does way more than a towel, than social media, just sitting around having these conversations, providing this platform that y'all have, grateful. This alone will allow us to go back and spread the word about, the ongoing services and growth that y'all are doing. So anyway, and we're
still going to do.
For years, for 24 years, I've been running this organization here in Dallas. 24 years.
One of the first people I met when I moved here.
That's right. Yeah, next year it'll be 25 years. But the thing is that promoting wellness, health, wellness, and recovery, especially with the social determinants of health and the ACEs, if you're not familiar with the ACEs, right? Those traumas, right? And guess what? The one trauma that they didn't have on it, Kaiser Permanente, when they started, was living while black. That was not on it. Okay? And so that's when we let them know, hey, that trauma is missable. That's what's happening in our community. Right? That's not really being said out loud. And that's not really being promoted out loud. So when you say, yeah, we don't see foremost, we have to go out there. I'm an outreach guy. The thing is that the homeless is a big thing, right? And so how do we really go to the people that's out there? I believe in via outreach and going out there. And so how can we support you out there?
That's what everyone has said. How do we keep this conversation going, and how do we spread the word? And I think, I work now at Dallas County Health and Human Services, and every single day I'm learning about more that's going on. And so I think, to that end, I know we're all in 1,000 meetings, but, we talk so much about how to get out of our silos. I work specifically in HIV, so there's so many people that do HIV when it comes to housing. They don't know anything about it. They're referring out. Same thing, whether it's primary health, maternal health, on and on and on. And so I think whatever opportunity, if we can take something from this, because I want to keep this conversation going. I want to meet again, as many times as possible, because there's just rich conversation happening here that I don't get in other forums. And it also allows for sharing of events and opportunities on a broader scale, so it's not just within, you know, your field. So, you know, just wanted to say huge supporter, even if it's just a quarterly or once a year convening as part of, you know, Health Week, to say we're going to have a forum and share, you know, what we're working on, events that you can be a part of, and even just, you know, emailing out, here's a flyer, so that it gets spread more broadly than just your listserv that goes to your community that comes from your field of expertise. So.
Great suggestion, Ms. Kelly, you have the last.